Hey, good evening, and welcome to your favorite medical show, Ask Dr. Saw. As usual, joining us from, he's still in England, is Dr. Saw. Dr. Saw, good evening.
Good evening, Akash, and to the viewers.
Wonderful, Dr. Saw. I just want to say to you, Dr. Saw, that the reviews and the comments that we're getting from this show has been phenomenal. It's been amazing, and people are really. Some people are saying to me that this type of information is the type of information they would always want to hear. Sometimes it's difficult for them to have access to this information. They like the way that when you can send in your question to us while we have this conversation on our subject tonight, you can send in your question to us. And next week, myself and Dr. Saw are going to address your questions. Of course, I'm going to be asking, and he's going to be answering those questions for you. And we have a number of questions from last week that came in. And after this first segment, we're going to go straight into that. Time runs out on us, so we've got to get into it. So, Dr. Saw, this evening, we are talking about a subject that is sometimes taboo. It's constipation, but I believe that every one of us, I believe, must have had some run-in with that particular issue, but constipation. So, I mean, most of us know what constipation is, but is there a specific criteria that defines what constipation is, though?
Yes, of course. For medical purposes, of course, we have to have a criteria. However, as you know, you said most of us are one-off, a couple of days. Constipation is infrequent or difficulty in defecation or passage of stool. So you're having some difficulty and it is less frequent. Mm-hmm. Now, of course, frequency, we then would objectively define what is considered normal. So there is something called the Rome 4 criteria. And Rome 4 criteria, in medically, that's what we use to say somebody is chronically constipated. And it says if you have 2 or more of these things that I will tell you about in the preceding 3 months, you would say you're constipated. And what are the things we're talking about? So if you have 2 out of these, 2 or more, and it should be in the preceding 3 months, 3 months prior, you haven't this. So you have less than 3 stool per week. So less than 3 stool per week. If you have 25% of the time, you have to strain. If you feel that you are a sensation of you're not fully empty, 25% of the time. If you feel that you are obstructed, 25% of the time. And if you feel that you have to use some sort of maneuver, where lots of people do digital evacuation, emptying, digital maneuvering, a sense of something is obstructed, hard or lumpy stool, and less than 3 per week. If you have those, you have two or more of those, you can say, if you used to go, your body tells you how you are. Some of us are trained differently. And I've got patients who say, I go 2 times a week, and I've been doing that for years and years, and it doesn't bother me. But it is, as I say, it is also associated with symptoms. So if you're uncomfortable, if you're going twice a week and find that's how you are, and you're not having symptoms, it is not ideal, because I will tell you some of the things that long-standing constipation can give rise to other problems. And of course, we don't want someone to go twice a week. We want you to evacuate your bowel more often than that, so at least 3 or more times a week.
Brilliant.
So yes, that's your criteria and that's your definition.
Brilliant. Before I ask you, I wanted to ask you the next thing. What are some of the major causes for constipation? But you also mentioned just now digital evacuation. Just touch on that a little bit for me, please. What is the digital?
So, of course, if you feel that you're blocked, you're obstructed, and you feel that, okay, the stool is coming out, but there is something blocking it, and you just feel it right down at the end of your anus, it is there. Lots of patients will come and tell me, Doc, I have to go in the bathroom, I have to use my finger, and so they use their finger, put it up their anus, and try to pull the stool out.
Oh.
So you initiate, so you're creating that initiation, because sometimes the stool is so time at least, and you have less than 3 per week, you can say you're constipated, and that will suit the definition.
Brilliant. I wanted to, like I said, I didn't know what that is.
Yeah, no, it is. I mean, it's something that I suppose it is so personal.
Yes.
And so private that you would not hear that. No one will come and tell you that this is what I'm doing.
Right.
But it is something that is very common. I've seen lots of patients over the years who come and say, Doc, if I don't do that, I don't feel emptied. I don't feel that I have opened my bowel properly, and it's an issue.
Right.
So, yeah, no, it's something. I know it's sounds a bit.
And I guess that's what that is why when at the beginning of the show this particular segment I said that that some of the this thing is taboo. A lot of people don't want to talk about it. But what causes constipation, Doc?
Well, various reasons. I mean, constipation is very there's no one cause, and lots of time, yes, we try to define and look at different causes. But there is always an overlap. There are a combination of things that can cause it. So just for simplicity, I like to do things in a very logical way for us to understand it. So we have something called, we can divide constipation when we look at the causes. Primary constipation, that is, there is no identifiable medical cause or underlying medical cause. We don't know why you're constipated. So we call that primary constipation. Or sometimes we call it functional constipation. And I explain to you the analogy sometimes that, you look at the pair of glasses and it looks okay, nothing is wrong with it, but I look through it and I can't see. So it is not functioning, but physically it's good.
Yeah.
So likewise, in primary constipation, it is sometimes defined as functional constipation. Idiopathic, as in no known cause. Functional, as in, physically there's nothing. And we call that primary. So there is no physical or underlying medical condition. And then you have secondary causes. Secondary causes meaning there is something else that is causing the constipation. So when we look, so we can then define, so we were looking more, when we look at the causes, we say, fine, you either have primary or secondary. Secondary causes, what are some of the other causes? So there's an underlying medical cause. You can have, let us look at the colon itself or the GI tract. So the colon and the anus, so your colon gets stored the stool and then it is evacuated from the anus. So if you have a problem there, as this is secondary causes now, so let's say, for instance, you have pain in the anus. Pain in the anus, like piles, an ulcer, it's called fissure. You may hold your stool in. You don't want to go because every time you go to the toilet, you're in pains. So you're training your body not to go. So that can cause constipation. As a matter of fact, that's a very common cause of constipation. If you have a tumor or something blocking the flow of the stool, so in your colon, if you have cancer of the colon, a mass, it doesn't have to be cancer, it could be any other mass. If you have a stricture, a blockage, the colon has got a normal size, if for whatever reason the size is smaller and you have a blockage. So those are, GI causes, the colon and the anal causes. Now, besides that, another secondary cause could be endocrine causes. So endocrine meaning, we talked before about thyroid disorder.
Right.
So I think I had mentioned when you have low thyroid, your body is sluggish.
Yes.
Because thyroid is the metabolic hormone that allows you to metabolize and it gives you energy. So if your thyroid is low, your body slows down, so that can give rise to constipation. If you have other endocrine problem where there's a gland behind the thyroid called parathyroid that can produce excess hormones, parathyroid hormone, and you have raised level of calcium. So whatever reason you have high calcium in your body, that can also cause constipation.
Right.
So it is defined, we acts and it causes peristaltic movement. So endocrine, let's see, there are other causes like what we call connective tissue disease. So there is a condition called scleroderma, patients who have got type of arthritic type of condition. So all these joint and skin disorder, you can get associated constipation with it. Big cause, medication. Lots of medication can cause constipation. People who take iron supplements,
right,
you know, they will come and say that they are constipated. People who take antidepressants, they can cause constipation. Patients who take psychiatric drugs, it can cause constipation. The bowel movement is controlled by the nervous system as well, cholinergic nerve we call it. So there are some tablets that you use, they are called anticholinergic. So patients who have got prostate problem or so, we can give them drugs to relax the muscles of the prostate, and these drugs can cause constipation. So that's your summary, and also not forgetting psychological causes.
Right.
So if you are, for instance, you're in a different environment, and
absolutely,
you go on holiday, sometimes people will come and say, Doc, I've been on holiday,
yes,
and I haven't opened my bowel for a week.
Yeah.
So that would be your acute constipation. So there are various causes, and you know, we tend to look, take a history, understand what else is going on, because it's not just only the bowel causes. We've talked about bowel causes. And if we can't identify any underlying cause, we will say this is functional or primary constipation.
Right. I mean, Doc, look, it may seem as if it's obvious to say what are the signs and symptoms of constipation. It may seem very obvious. But from a medical standpoint, can you then tell us, Dr. SAWH, what are the signs and symptoms that we should look out for?
Of course, you said commonly, I mean, you all know, you can't pass stool.
That's right,
I mean, I can't pass stool and I'm uncomfortable. So you would have to have some degree of discomfort.
Right.
And what is the discomfort? You'll have abdominal pain. So you have abdominal pain, you may feel a sense of bloating, and you may feel a nausea, sickness, you may even vomit. Some patients with long-standing constipation, they say, Doc, I'm always bloated. I feel that there is gas coming up, I'm belching a lot. I feel sick, I feel nauseous. And constipation, as I said, even in reflux disease, constipation can give rise to acid reflux. You have more gas building up in the stomach, and you have acid reflux symptoms. So you have tummy pain, bloating, acid reflux. Constipation can cause back pain. You can have back pain as a result of constipation. You can have urinary retention. You can't pass urine because of your constipation. Associated with constipation is a cause as well. Patients usually come and say, I've got anal pain. So if you've got hemorrhoids, so whenever you have you're looking for causes as well, but these patients, these are the symptoms would allude you that, hey, there is something going on. I've got constipation and I've got anal pain. So if you have hemorrhoids, if you have an ulcer, which is like something we call a fissure of the anus, they can also cause constipation. And yes, the symptoms you'll strain, so straining can do that. Now, something that is probably not, I mean, we don't see that commonly. However, in my part of the world, I see it very commonly. If a patient were to, usually I see patients in residential home or nursing home, and we're talking, it's only because of life expectancy, I say we don't see that commonly in Guyana. But life expectancy in the UK, for instance, is over 80-something years, 83 plus years life expectancy. So we have a big chunk of elderly population, and a common cause of confusion, acute confusion, is constipation. So ever so often I get called in to see patients in residential care, and patients with poor mobility, and suddenly they get confused. What do we look for? In acute confusion, you want to know, is there any signs of infection? So if you have urinary tract infection or infection, and also constipation is a big cause of confusion. So it is not just, all right, I'm just constipated and I've got some tummy pain. You're delirious. You know, so it's not something as trivial as it may seem. It can be, it can have serious, implications.
I had a case. I had a case. Someone came to Guyana some time back, and they were here in Guyana, and they stayed at a hotel, and for 5 days they could not go to the. They could not go. I think I think I had mentioned it to you. I had to actually
Yes, of course.
right. I had to actually call in. I had to actually call an emergency. Made an emergency call for them to go in, and she ended up at the hospital. Thank God she's okay now.
No, of course.
Yeah, but
I remember that we spoken about that before.
Right, but she, this person was there in the hospital suffering. He really, and I don't know because of the taboo, she doesn't want to call. It's going to be shameful to say that you're constipation. I mean, what are some of the red flags that we should look for, though, Dr. Saw? I mean, are there red flags in this whole setup?
No, absolutely. There are red flags and there are complications.
Mm-hmm.
So red flag is telling us that, okay, you don't have, this constipation is not something I should just, ignore. This is a constipation that is telling me something else is wrong with me, and I should see the doctor, and I shouldn't just take laxative or say, right, this is normal constipation. So what are the red flags? If you have constipation and you're losing weight, that's a red flag.
Mm-hmm.
So we will tell anyone, if you're constipated and you're losing weight, you should see the doctor, because we want, in the back of our mind, we want to make sure it is not cancer.
Mm-hmm.
So more or less, we are looking to exclude cancer, because the guidance tell us that anyone who has got, especially over 50, if you've got a change of bowel habit, so if you used to go once a day and then you start going every other day, and you're over 50 years of age, that's a red flag. Change of bowel habit with weight loss or something else will tell us that this is constipation. If you are anemic, so if you're constipated and either I look here and you look pale as if you're anemic, or I do a blood test and it shows that you're anemic, that is telling me that you're bleeding and you're constipated. What can cause that? So cancer of the bowel presents like an ulcer.
Mm-hmm.
Now you have an ulcer in the bowel, and generally, as you know, cancer starts like an ulcer and it grows and it spreads and it expands. You may bleed slowly that you don't see it. The blood is mixed with the stool, but it is microscopic.
Oh, okay.
So you don't see it in the toilet. And that is why one of the things we do in patients, we send them for a stool test to check to see if there's microscopic blood. It's called a FIT test, or fecal occult blood test. And if that is positive and you're constipated, I will always send you to have a camera. That is to do further testing,
right,
through cancer. If I feel that there is a mass in your tummy, I can feel if you're constipated, of course, you want to examine that patient. You will feel if there's a mass. If there's a mass, of course. What else? If you've got a family history of cancer, bowel cancer that is, and you're constipated, that's a red flag for me. I will go on. And if you have rectal bleeding. Now, rectal bleeding without an identifiable anal cause. So if you're constipated and I find that you said, okay, doc, I'm bleeding and I'm constipated, but I have hemorrhoids, I go and examine you, and I see you've got hemorrhoids, I say more than likely this is coming from the hemorrhoids. I can see it. Or you've got an ulcer of the anus, I can see that. However, if you're constipated and there's blood in the stool, in the toilet, and I can't see an anal cause, I want to investigate that further. That's a red flag as well.
Right.
So, I mean, that's your summary of red flags. And then, of course, what are the complications? Can constipation be dangerous?
Right. Yeah. I mean, you did mention some of the investigative methods that you can use there. But I always ask to the extreme if I mean, constipation, I'm sure that it can do some harm because it will damage tissues and all that. But can constipation be lethal?
Lethal is it going to kill you?
Yeah,
well, yeah, depending on the cause. I mean, yes, if constipation is as a result of cancer,
right,
and you ignore it, of course, because you can have a blockage, a cancer blocking the flow of stool, and of course that can be fatal. So you ignore the constipation and you're losing weight and you start getting blood, and by the time you realize it, it's too late, you've got bowel cancer that spreads. Bowel cancer is a cancer that is so curable, to be honest. Curable meaning if you've got bowel cancer and you pick it up early, you just treat it, you resect the bowel, you're cured, as in no
Wow.
But if you allow cancer to spread to other parts of the body, I mean, then that is, usually terminal, or that will lead to death eventually. So we want to pick up those things early. So it's not just trivial. So complications, yeah. But that's an extreme position, an extreme case, I'm telling you.
But Doc, 1 minute, please. Here, look, I understand that. But what I'm asking about, look, I know sometimes when you can't make it to the toilet in time, it doesn't have to be constipation. So you cramped up, you can't move, you can't,
Yes.
And I'm pain is and this sometimes there's not even constipation, just that you can't make it, you not close to a toilet. I can imagine people who are constipated and have to go through this for days. I'm thinking you get cold sweats, you would feel like you can't breathe properly, and so I'm thinking, man, that could kill you. I don't know. I could be wrong, but
I suppose pain by itself can give rise to things like, if you are, I always say, there are
threshold low
that we have who are sitting on that equilibrium, where they are just sitting on that thin line where there's an equilibrium there, and when that equilibrium is shifted in a way where it causes an imbalance, it can kill you. And I mean, this is classic of, you have seen patients where they have lots of medical condition and we're just getting them tipping over.
Right.
They just got a flu and they die.
That's right. Yeah, because you got underlying conditions.
That is the point. So what you're describing there is that if you have a patient that they've got so severe pain, and the pain triggers something, the pain can trigger your heart going into an abnormal rhythm.
Yes.
The pain can trigger your blood pressure. Your blood pressure
abnormal breathing too.
High. And abnormal breathing, of course. It trigger a heart attack. So pain by itself can be fatal if you are sitting at that equilibrium. So it is not that none of this thing can be fatal. They can. So you got to look at it in that context. But one of the more serious things in constipation, you have a blockage. So if you have a blockage, it can cause bowel obstruction. So think about it. Your bowel is not opening, so you're not passing stool, you're not passing wind. The bowel is totally blocked.
Right.
What tends to happen? You get toxins building up. You have gas building up. Your tummy gets distended. You start to vomit because you cannot take anything down. Everything is regurgitating. And that is defined as bowel obstruction. And of course, that can be fatal as well. Now, constipation can also give rise to anal problems. We have blamed constipation on things like you strain and you cause a tear in the anus. So it says we are. Yeah.
So we got Doc. We got about 5 minutes more on 5 minutes more to finish up.
Fine.
Yes.
Just, clicking that. With anal problems, so the constipation can give rise to a tear in the anus. So we call that anal fissure. Constipation can cause high pressure in the anus and rectum, and there is a condition called diverticulosis. And when it is inflamed, it's called diverticulitis. So, the bowel has got a wall, and the pressure in the bowel is, should be at a certain pressure. If that pressure is elevated and there's a weakness in the wall of the bowel, you have an outpouching. So, I always make a reference like a balloon.
Right.
You blow a balloon, and if the wall, part of the wall of the balloon is weak, you see a bulge.
That's right.
Or a bicycle tire.
Yeah.
Yeah, you see that little bulge. So that is called diverticulosis. And when that gets inflamed, it's called diverticulitis. And it can present like, appendicitis, it can burst, it can cause an abscess, it can cause... So you can have complications as a result of... complications as a result of constipation, that they be diverticulitis. What else? Pelvic floor. I mean, they've blamed constipation as a cause of weakness in pelvic floor. So in women who usually they can have weak pelvic floor. So when they sneeze, they have urinary incontinence.
Right. Yes.
And so all of that can be linked to constipation. So it's not just, it's something that we should look into and we should manage and treat.
Before I go, we got about 4 minutes more to go. But before I go to ask you about treatment, I want to ask you this one thing more quick, because I heard this when I was a kid. If the walls of the intestine becomes really weak and the stool is very hard, can it burst through there? Can it burst?
It can, yes. So that is happening. That in that diverticulosis
yes.
Condition I explained. So the wall is weakened. It has a bulge, and usually, if the pressure is high, it has a bulge, and you have inflammation, then it can burst.
Right.
So you can have a perforation.
Right.
So you can have colonic perforation as a result of that. So, and then when you have a burst, you can be septic. It can cause it to be fatal because the poo now gets into your.
That's right, in the abdominal cavity, right? Yes.
Correct.
Yeah.
And then also that weakness, when it gets inflamed, it can get attached to the, we call it a fistula. It get attached to the, let's say, the bladder.
Right, right.
And then you have poo into your bladder.
Yes, yes.
Because remember, all the tracts of the body, they're closed up. So from your mouth to your anus is a little tract that it doesn't have connection outwards that leaks into anywhere.
All right.
So if there is a little perforation there, it gets into the rest of your body.
All right. So tell us about treatment. Tell us about treatment in a few minutes, Doc.
All right. Quickly. So treatment. I always advocate. Let us talk about non-pharmacologic means of managing constipation. And the important thing is lifestyle. Let us look at our diet. So diet, fluid, and fiber. Think about the two F's. Fluid and fiber.
Right.
So you want to have enough roughage or